Introducing the smallest wide-spectrum microcurrent device in the world. It is a wearable, drug-free, non-invasive pain management and tissue repair system. No matter where the injury is, we always place the device on the cannon bone. It does not have to be anywhere near the source of injury. This small device, which is just a little larger than a credit card, hosts a very complex algorithm of frequencies to bring huge benefits to your horse. So how does it all work? Well, it works with something called adenosine triphosphate, or ATP for short. The body's natural bioelectrical signals are required to produce ATP, which is responsible for the flow of vital nutrients into and out of each cell. ATP is the power behind this complex transportation process. This is why it's referred to as the energy source. Think of it as an engine that drives a pump. Injury or disease to tissue cuts off the electrical signal and decreases the ATP produced. The flow of vital nutrients then slows dramatically like a dam across a river. This results in the accumulation of metabolic byproducts due to a lack of energy to transport them out of the cells. This build-up is inflammation, and inflammation is perceived by the body as pain. Our microcurrent technology replicates the body's own natural bioelectrical signals. It turbocharges the ATP production by up to 500% when the body is least able to. This kickstarts the body's recovery, allowing pain reduction and healing to start early. Due to the healing starting quicker, some soft tissue injuries can heal up to 50% faster, which means a better repair, less scarring, and less long-term damage. The first thing you'll notice is that the inflammation will be reduced, and in turn, the pain is reduced too. The body can then start the natural healing process much sooner. As it works at a cellular level, all tissues respond to microcurrent therapy. The list includes bone, tendons, nerves, and wounds. By improving the ATP production, ArcEquine has been successfully used to help with conditions like arthritis, tendon injuries, and sarcoids, to name just a few. Microcurrent therapy has also been used to repair micro tears in muscles before they become an issue, as well as general bruising and swelling. ArcEquine is used by the elite of the elite when it comes to the equine world. Here are just a couple of names who use the device to improve the performance of their horse. The device is very simple to use. You turn it on with one button, select the relevant treatment option based on the condition of the horse, then press Start. The programs follow the natural healing pattern of an injury. Phase 1 for the initial injury. Then, as the inflammation starts to reduce, we move on to Phase 2. Towards the end of the injury, when we need to concentrate on the repair, we move on to Phase 3. Phase 4 is our maintenance program. If there are no injuries and the horse has used the device before, ArcEquine can be used to top up ATP within the body. We recommend this phase is used twice a month. However, you can use as you see fit, as you can't overuse or misuse microcurrent therapy. Next, we have a couple of examples of what microcurrent therapy can help the body to do. Sarcoids. This was a relatively small sarcoid to what we normally see. However, nothing else was used in the treatment of these, no cream and no laser therapy. And as you can see, they are pushed out from within, the root system as well. They do tend to look worse before they fall out, so don't worry. As you can see, there was no scarring and no reoccurrence of the condition in that area. Graphic warning here. This was a young horse who reared up in the field and landed on a fence post. The wound was so deep, the vet could get his hand in up to his elbow. The wound was packed and stitched, but the stitches would not hold. Therefore, it was left open with fly ointment to stop them infecting the wound. From day one, the ArcEquine was used. 16 weeks later, not only was the wound completely healed, there is little or no scarring and no white hair. Against all the odds, Joycey is now competing again. Tendon tears. ArcEquine has helped more tendon injuries than anything else. In this example, the hole was around the size of a golf ball, and the horse was given only a 50% chance of getting to a hacking horse. No other therapy was used. Grommet was turned out when weather permitted whilst using the ArcEquine. 12 weeks later, not only could the vet not find the tear when he examined the area using the coordinates of the original scanned injury, all the fibres had healed in alignment, with no crossing or damaged areas. As mentioned before, the unit has a 2-year manufacturer's warranty, should there be any fault. However, accidents happen. Therefore, if the unit is damaged and not covered under warranty, we offer a no-quibble swap-out service. For a fraction of the cost, we will send you out a new unit upon receipt of the old one.